So let's say you decide you no longer want to offer health insurance. First, I would ask if, because it sounded to me like you would be willing to provide some contribution, but if you decided not to, do you think you would want to then dump your employees onto any particular plan?
I mean, not really. We already have the cheapest plan we can get. So I'm not sure what other plan we would dump them onto.
Yeah. Well, and the point here is that, one, you're willing to make a contribution, so you're willing to try to help them get a plan. But the way this new program would work is that your contribution would make it possible for your employees then, if you were to not offer a plan directly, to take your contribution, use it to then be able to go into that marketplace and shop for any number of plans that would be out there. The competitive menu of plans that would be provided by private insurers and a public insurance option that would be out there. And whether somebody would attempt to dump employees into this new marketplace, ultimately the choice wouldn't be the employers about where they would end up.
Yeah,
the choice would be the employees or the consumers about which plan they would select.
Yeah, and I mean, I think it doesn't, it wouldn't have as much of an impact as us because we already buy individual policies for the plans. And so we already do what the exchange is doing in that they get to pick out whatever individual plan that they want. I think one of the biggest problems you have now is that it's kind of like when I watch old people at Walgreens trying to enlarge their own photos, in that it seems easier because, well, you have control over it, but they don't know how to operate the machines. It saves Walgreens some money because they don't have to do it anymore, but it takes them longer and gets them a worse product if they do it themselves. I don't read plans professionally. I mean, it's not what I sit around doing. Most of my time is spent thinking, how can I generate more money to send in taxes to the federal government? And I think that's probably what you guys want me to be doing, rather than spending time sifting through plans. The problem we have now is that they're written so complicated that it's hard to understand exactly what your deductibles are. So I wouldn't want, just my employees to be shopping through the complicated plans we have now in the same way I wouldn't want the employees investing my money for me. It's just, I don't have faith that they'll be able to do it. My dad is an insurance attorney, so he actually reads through our plans for us, but not having that kind of crutch makes it really hard. So I think on the one hand, you need the exchange to really simplify, like people were saying earlier, have a standard for how to compare plans one to the other.
Well, the good thing is it sounds like what you do is you give your employees a choice of what plan they want to take.
Yeah, they can get any plan they want, and we just, through my dad's recommendations, will recommend to them, this one is a good plan. But
and this proposal, this health care reform proposal, would in essence build on that model that you've
yeah, I think
described.
It matches up with what I said earlier. Most young people want to be able to buy a plan that's not tied to a company. They want to just buy a plan that they can take with for life. And so it appeals to us more, less than if we had a huge company plan. It would be more of a shift. But right now, it's not that big of a deal for us.
Thank you.